because of this disease. There is no cure for Tay Sachs, which means there is a prognosis. Because there is no cure, this individual, patient, child will need to go through treatment for the rest of their life. Treatments to help manage Tay Sachs, as Sarah mentioned, can include medication like anti seizure meds, respiratory care, feeding tubes, therapy such as physical therapy, emotional therapy. It truly just depends on how severe the disease may be on the individual that will choose and pick which treatments will fit them best. There is a life expectancy, unfortunately, and it's of an average of 2 to 5 years. Of course, this does vary. Some individuals can live for a shorter amount of time, some may even live a little longer than that. It just depends, again, like I said, on how severe the case is. With this disease, like some of others, comes epidemiology. So, epidemiology basically means that people who live in certain areas or have people from certain areas are a risk factor for having this disease. The number one that you will hear about, that you will see about, that you will read about, and is most mentioned is those from the Eastern and Central European Jewish communities, also known as Ashkenazi Jews. Within this community, 1 in 30 individuals carries the gene that causes Tay Sachs disease. Aside from the Jewish communities, certain French Canadian communities in Quebec can also be a risk factor, as well as Old Order Amish communities in Pennsylvania, Cajun community in Louisiana, and those of Ireland descent who live in Ireland, who come from Ireland, who have family in Ireland. Here we have a photo of an Irish family. On the left, we have Catherine, and on the right, we have Aaron Harney. These are the parents of Nathan, who was diagnosed with Tay Sachs. This picture was taken in 2013. Nathan was diagnosed at 10 months old. Neither parents knew they were carriers, knew whether they were carriers or not, because they had no idea. Absolutely no idea. Mom says that she wishes she would have known that she could have gotten tested. She wishes she would have known that because she was Irish that she could be a carrier of the disease. But because she didn't know this, and neither did dad, they wanted to raise awareness. So they raised awareness with the Einstein Medical Center, which was where their son was treated. A doctor who is named Adele Schneider is a doctor who studied their son's disease along with 2 other Irish families that were affected. Dr. Schneider helps in educating people of Irish descent. So this is how she raises awareness. For example, there's Irish festivals that occur in Philadelphia where she attends and informs people, hey, you're from Ireland or you're from Irish descent. I just want to let you know you may or may not be a carrier. It's better to know than to not know, so you know what can possibly happen to your future children if you do plan on having children, or even to your family members. Dr. Schneider also mentioned that there is no guideline to follow on whether pregnant women should be tested for having this disease, especially those who come from places that are at a risk factor for having the disease. The name of another case that Dr. Schneider studied is that of Dylan James. Dylan James is the son of Sherry Manning. He, unlike Nathan, was diagnosed at the age of 17 months. He passed away at age 4 in 2006. Both these mothers didn't know that they were carriers, and then they wished they would have gotten screened. So they took this information to raise awareness, and they let their families know, like, hey, I have it. It's a possibility you may have it. Go get tested. So because these mothers did this, Catherine actually found out that two of her sisters were carriers of the disease. Sherry also found out that she had a sibling who was a carrier. Both these moms were just doing their part and possibly even helped out those family members that didn't even have a clue in their head that they may have been affected by Tay Sachs in some way or another. Sherry Manning, the mom of Dylan James, also raises awareness by giving out bracelets about Tay Sachs, informative of Tay Sachs, as well as just giving out info that people may not know about that she knows could benefit from this information. Now, we are going to take a little trip back in time and go over the history of Tay Sachs. Well, at least some of it. Warren Tay is the British ophthalmologist that helped in finding and diagnosing Tay Sachs. Bernard Sachs was a New York neurologist who also helped, hence the last names and the name of the disease. Although both of these individuals worked and diagnosed this disease, they didn't work together. Bernard provided the first description of cellular changes that happen when an individual has Tay Sachs. He also noted, when studying the disease, that children mostly affected were those of European Eastern Jewish. Like I said before, are from a place, and the number one place that you'll hear about, that are a risk factor. Warren, in the year 1881, described a patient having a cherry red spot on the retina of the eye, which is a symptom of an individual who has Tay Sachs. So that was when he started doing more research towards finding out exactly what this disease was. The gene that was affected by Tay Sachs was identified in the years of the 1980s. By 1990s, though, 75 different mutations were found in regards to Tay Sachs. About 16 cases are diagnosed in the United States each year. Although this may or may not seem like a large number, it is very rare in the general population, meaning worldwide. It is very rare, and there are not a lot of cases. Because it is very rare, and even though it is very rare, it affects males and females in equal numbers. So there's never a case where, oh, more males are affected, more females are affected. No, it's usually about the same numbers. Here on the left, we have a picture of Bernard Sachs, and here on the right, we have a picture of Warren Tay. A little more history about Tay Sachs. So this disease is also known as, also tied with, or maybe mentioned when you hear this, are B variant GM2 gangliosidosis, GM2 gangliosidosis type 1, Hex A deficiency, hexosaminidase A deficiency, hexosaminidase alpha subunit deficiency, variant B, sphingolipidosis, and TSD, which is an abbreviation for Tay Sachs disease. Because most individuals that have Tay Sachs die at a very young age, children basically, there are no recorded cases of celebrities or any other famous person who has suffered from it. So it's very rare that you will ever hear, probably unless this individual is a famous baby star, that they will not be like, hey, just in, this celebrity has Tay Sachs disease, or hey, this celebrity, this famous person has been diagnosed, so on and so forth. So it's very rare, probably one in a million that you will hear that a celebrity or famous person has this disease. Now we're going to talk about the research. Obviously, scientists, individuals, they're searching for a cure. This is the number one goal above all, so that if a child is born with Tay-Sachs disease, boom, we have a cure. This child is good. They don't have to suffer anymore. We can take that pain away. They can live a longer life. Of course, they're still working very hard to finding this cure, but if they cannot find a cure, they at least want to find treatment to be able to slow down the process. Gene therapy or enzyme replacement therapy is also in the works. So basically, they want to know like, I want to have kids, I want to have a family. Do I have this disease because I come from this descent? Okay, yeah, you have it. So they want to find research to where they can say you have it, but here we have this therapy that we can use to help replace it so that you can have kids and they are not diagnosed with Tay-Sachs. The research and testing is done to prevent, detect, treat, or even manage and try and control so that they can slow down the process so that these children do not have to suffer, so that they do not have to go through this process. The Einstein Medical Center is also working on research, for example. They have designated their research to finding out whether or not carrier screening should be recommended to specific populations. So, like I said, there are specific places who are more bound, who are more risk to having this disease. So they want to know, hey, should we tell these individuals like this disease is really serious, you need to get screened, you need to get tested. We want to know if you are a carrier. That way we can stop your children or your family members from experiencing this disease within their household, within their family, so on and so forth. Now, here we have an image of a couple who had a daughter who suffered from Tay-Sachs disease. On the left, we have Bruce Steiger. On the right, we have Rick Carl. And right in the middle, we have Christy Carl Steiger. This couple has made an impact on the research that has been done towards Tay-Sachs. Their daughter was born with the disease in 2006. Unfortunately, she passed away at the age of 9 in 2015. Therefore, this is one of the cases where the individual who was diagnosed lived a little longer than the life expectancy. What happened here was the agency, the industry, where they got an egg donation had a lack of genetic screening. Therefore, they didn't screen these individuals for having Tay-Sachs. So when they did this donation, they didn't even know that the daughter was capable of having Tay-Sachs. But if the industry, the agency, would have done that screening, they could have stopped it and could have stopped this couple from suffering the way they did with their daughter. Because of their specific situation, they wanted to make a change in egg and sperm donations. Whether it was an agency, an industry, wherever it was, they wanted to make sure that people didn't have to go through the same situation. Because of so, they founded and funded the Cure Tay-Sachs Foundation in the year 2007. This fund was dedicated towards finding a cure. In 2019, this foundation gave a grant to support future clinical trials that could help find the cure for Tay-Sachs disease. They awarded this grant to Queen's University in Ontario, Canada, and it was a total of $154,660. They used and sent this money. All of it was raised towards helping find a cure. In total, they have issued and donated grants to 9 different researchers and laboratories. This foundation has been so successful that they have raised close to $5 million total in hopes of finding a cure. So here we we have our sources. And here we have our crossword puzzle answer key. I hope you like our little emoji here and that you enjoyed our presentation and did well on your crossword puzzle, Dr. Jalota. Thank you for everything, and that is it.